So, do you ever feel like you spend more time writing SOAP notes than you do with clients? Well, let's change that. Today I'm going to show you how to efficiently craft detailed SOAP notes, saving you time without losing quality. Hello and welcome back to the channel. My name is Jess Reynolds, and if you're joining us for the first time, it's really great to have you here. We're all about enhancing your practice in meaningful ways. In this video, we're going to be diving into the art of SOAP notes and charting. This is essential for any practitioner, and I'm going to guide you through techniques that are going to make your note-taking both thorough and efficient. But make sure you stick around because I've got a special tip that really transformed my charting process. It's a super simple tweak and it's incredibly effective. Today's video is sponsored by Jane EMR. Now, SOAP notes, they've got a pretty interesting history, and that history shapes how we use them today in integrative medicine. The acronym SOAP, of course, stands for Subjective Objective Assessment and Plan. And the idea is SOAP notes are a structured method for recording patient or client information. Great, nothing new there, we all knew that. But here's the interesting bit. You see, SOAP notes were originally developed in the 1960s by this dude named Dr. Lawrence Weed for doctors and nurses in hospital settings. SOAP notes were designed to standardize the medical record-keeping system. Now, this format, it ensured clear communication and continuity of care in a very fast-paced conventional medical environment. And that's an important bit of information, because the main point of SOAP notes was to standardize how notes were taken so different nurses and doctors who are working different shifts and in different hospitals knew exactly what was going on with the client and what had to be done and what the plan was moving forward. Now, fast forward to today in our integrative medicine world, and we have adopted the same methods, albeit we've had to alter things a bit because we operate in a different context. And while we might not operate in that hospital setting, the core principles of SOAP notes, they're invaluable. Because the systematic process of documenting a wide range of conditions and interactions, it's helpful for us no matter what modality we're practicing. So if you're looking to dive deeper though, this video, it's just going to be how to speed the process up. I've got a full long, hour video that dives into all the different aspects of the SOAP note-taking process, and I'll leave that link in the description below as well. So for us in the integrative medicine world, this means adapting the format to suit our unique practices. Now, the subjective part, that remains pretty much the same. It reflects the patient or the client's personal experience and their symptoms. The objective part, it captures observable data. Assessment, this involves our understanding of the patient's condition, and it's where we would write the diagnosis, if giving one is within your scope of practice, or where we would write our clinical impression. And the plan, this outlines the comprehensive treatment or the approach we took while working with our client. So in this way, SOAP notes allow us to communicate our findings and our plans in a language that's universally recognized across the healthcare spectrum, while ensuring clarity and consistency in patient records. Again, it's continuity of care. Now, this matters for all of us, no matter if you're working in a multidisciplinary setting or you're working solo from a spare bedroom in your house. SOAP notes, they're like a letter to your future self, reminding you exactly what you did and what needs to be done. All right, this is all fine and dandy, but the real point of this video is to give you practical tips on how to take better notes. So now let's take a look at some strategies to streamline the charting process without sacrificing detail. My first strategy is learning shorthand and abbreviations. Now, shorthand and abbreviations, they can speed the note-taking process up a ton. But remember, if you do use them, you are obligated to keep a legend of your shorthand or abbreviations. Now, technically speaking, we could all come up with our own unique shorthand, but I suggest you use the more standardized shorthand that already exists. The easiest way to find out what is best is to just Google your modality abbreviation list. Now, this is going to give you the most commonly used shorthand in abbreviations. For example, you could just write in massage therapy abbreviation list. Now, my second strategy is to utilize quick keys and shortcuts. Remember that special tip I mentioned at the beginning? Well, this is it. If you're using an EMR system, which I strongly recommend, take advantage of quick keys and shortcuts, and they're built into almost all of the major EMRs. This can speed up the charting process immensely. Now personally, I love Jane EMR, the sponsor of today's video. Jane offers a ton of really amazing features that speed the charting process up. Things like duplicating notes from previous sessions, they're very helpful, but my personal favorite feature is the phrases feature. This is a lot like shorthand, but it makes things even more clear. Let's say, for example, I want to write out performed trigger point therapy on the upper trapezius. I could then just make two separate phrases, one for trigger points and one for upper trapezius. Adding phrases is super quick. All I need to do is just add one for TRP, which would then be turned into performed trigger point therapy, and then another one that's UTPZ, which will be then the shortcut for upper trapezius. When I'm typing out my SOAP notes, I just write out TRP, UTPZ, and bam, just like that, the phrases make a complete sentence. And you can make phrases for all your common treatments. Now, this is just one of many time-saving features that are packed into Jane. If you're interested in trying out Jane, just go to jane.app and make sure to use the code AIM1MO as the education or association code when you sign up, and you'll get a 1-month grace period on your new Jane account. Remember, while speed is important, detail is paramount. Be thorough in recording what you have done during the session. This not only helps you track your client's progress, but it's also a very valuable bit of information for planning future treatments. No matter if you're using an EMR or writing with pen and paper, detail, it's essential. Now, there's something of a mental game going on here. Earlier, I mentioned it's helpful to imagine that you're writing a note to future you, and you want future you to know exactly what's going on. It might also be helpful to imagine that future you is reading the notes on a day when future you missed their morning coffee and can't quite remember the day of the week. What I mean to say is, don't assume that future you is going to remember anything. Be detailed. And by adopting this mindset, instead of just viewing charting as an obligation, it is shocking how much easier and quick the process gets. Now, I get it though. The idea of being super detailed and thorough can mean that we spend a lot more time writing out our notes, and that's where we can leverage technology once more. Almost every modern device today comes equipped with a voice-to-text feature. It's an incredibly simple to use feature, and for many of us, speaking is way faster than typing. So imagine that you've just finished a session, the details, they're still fresh in your mind, and instead of sitting down to type out everything, you just click a button and you start talking. This approach isn't just about speed, although that's a big plus. It's about capturing the nuances and observations that might have slipped away when you're typing everything out. When we speak, our thoughts can flow a lot more naturally, and this could lead to more detailed and insightful notes. At least this is very much the case for myself. Of course, like any tool, it's not perfect. You're going to want to review and edit the transcriptions to ensure accuracy, especially when it comes to any medical terminology or jargon that you might use. But once you get the hang of it, you might find, like I did, that voice-to-text transforms the way you handle your charting. It's like having a personal assistant who types as fast as you can speak, and the technology, it's only getting better. Finally, let's reshape our approach to charting in general, transforming it from a routine task to a meaningful ritual. Yeah, this is another mental strategy, but it's one that's incredibly effective. When we start seeing charting as an integral part of client care, as a special moment in our practice, it shifts the entire process. Firstly, try to capture quick notes right after each session. This is when your observations and what you've done and your insights, they're still fresh in your mind. For me, this involves using that voice-to-text feature to record my ideas really quick. It's a small step, but it makes a big difference when I sit down later for detailed charting. Now, here's the key part. Setting aside dedicated time at the end of your day exclusively for note-taking. This isn't just about keeping up with documentation. It's about creating a space for yourself. In my routine, once all of my sessions are done for the day, I throw on some of my favorite tunes in the background, I get a nice cup of cacao, and I sit down. It's not merely note-taking, it's a moment of calm reflection. It's a time to decompress and an opportunity to appreciate the day's work. It's also about setting boundaries between work and personal life, especially in our field where we often absorb a lot of our clients' energy, their pain, their aches, their issues. It's crucial to have a clear cutoff point. So this end-of-day ritual helps ensure that we leave our work at work, safeguarding our mental space and our own energy. Integrating this practice into your daily rhythm does more than ensure timely and accurate notes. It's about making documentation more natural and enjoyable. It's an aspect of our day that we might come to enjoy. And let's not forget, for many modalities, completing SOAP notes by the end of the day isn't just a good habit, it's a legal requirement. So there you have it. These are my strategies to streamline the charting process, allowing you to spend less time writing and more time providing excellent care to your clients. Remember, the more efficient and accurate your notes, the better your treatment planning and the client progress tracking will be. All essential things. Thanks for tuning in. If you like this type of content and want to learn more about how to build a practice you love and the skills to sustain it, please like, subscribe, and share your thoughts in the comments below. It helps us out a lot. Until next time, take care and be productive in a way that enriches your life.